Good morning.
Good morning. Happy Monday.
Thank you for attending the Dr. Simonds Metabolic and Weight Loss Ask Me Anything Facebook Live. We're open today in Raleigh and in Durham. Our Raleigh location is on Falls of Noose Road, 8300 Falls of Noose Road, Suite 112. It's right out by 540. And the Durham location is at South Point, just across from David's Bridal and REI. So today is the 1st of November.
Happy
yes,
November.
It is.
Yes.
It's the 1st of November, and we're happy to be here.
Yes.
And we kind of had a couple hiccups there in September, but we're back on track.
Yes.
We're giving away a $25 at Target gift card again today.
Again, yep.
Get a like the video and hashtag Simonds AMA, right?
Yes, in the comment section. Just do those two things. Yeah. And then we're accepting live questions as well. Y'all have been really good about submitting your questions live, which we love. We have submitted questions already that we go over, but we always want to hear from who's watching. What you think, what you need. That's what we're here for. So thanks for your participation. Let's jump in.
Let's do it. Yeah. So, what do you think, Kathy from Wake Forest?
Kathy, how long is an appointment? What is generally covered in each one? It's a good question, right? It's kind of how the practice works. So our first appointment, we schedule anywhere from 45 to 60 minutes. So when we say you want a lot, about an hour to be here, we do have you fill out some paperwork before you come and do some required educational reading before you come, just so you're really well prepared to get the most out of your appointment with us. And then the follow-up visits are once a month, and they're usually about 10 to 15 minutes. Some people need a little longer. Some people, they're on what we call cruise control. They're doing awesome, and we don't need to spend as much time. But generally, we schedule them about 15-minute blocks, so we don't take a lot of your time up.
That's right.
Try to make it easy.
Yeah, it's pretty simple. We do it once a month, unless you want it more often than that. We realize most people work; they're busy, they have families. We view it as a long-term process, this treatment of obesity, right? So we don't have to cover it all in one visit.
Yeah.
We don't have to take 2 hours of your time and beat you over the head with the idea of counting calories and all this other sort of thing. We can take that, the stuff you're good at. We try not to just belabor the point. The stuff you need help with, we kind of focus on that as you go on. That really shortens down the process. A lot of places, they bring you in, they make you buy a bunch of stuff, to make you go over a bunch of stuff you already know, okay? And it's like, okay, they treat me like a kindergarten child here. We try not to do that.
No, it's very individualized, and we really pride ourselves in meeting folks where they're at and guiding them with how they need their journey to look and what they need their journey to be.
Yeah, that's right.
So what is generally covered in that first visit is we're going to do a full metabolic assessment. You're going to have filled out some paperwork about medical history, weight history, the medications that you take, some social information, and diet history. And we're going to use that as a way to figure out how we're going to guide our journey together and our plan, our treatment plan. And then the follow-up visits, we really are figuring out, how did this past 4 weeks go, and what do we want to plan for so we have a really good 4 weeks going forward. So each visit is going to be tailored to what your needs are. Right? Coming into the holidays, we're probably going to be talking about, hey, what do you have going on for Thanksgiving? What do you have going on for Christmas? Are you traveling? What do we need to plan for? What do you need help with? And then we partner, and we help you figure it out, how it's going to work best for you.
Yeah, that's right. That's exactly right.
So thank you, Kathy. That's an excellent question. Thank you, Lori, for submitting for your Target gift card. We're going to move on to Tamara. You want to take Tamara's
question?
Tamara.
So if I understand this question right, it's what should you consider before coming off of keto and starting back up? I'm not sure about the starting back up and the coming off. Look,
we answered something similar last
that is correct. Coming off keto, don't try not to come off keto. Why would you come off the keto? What human beings prior to the last 150 years were on something other than keto? Okay, so we have millions of years of history on the planet. Okay, and animals and humans eat animals, and what grows naturally. This isn't getting interactive. This is called a ketogenic diet. Okay, our cells are adapted to it. It's only, look, don't fall for the Jedi mind trick that you got to have all these carbs. It's a Jedi mind trick. Okay, you just got to just say, okay, no, I'm not playing the game here, because really there's no need to go back to eating a bunch of flour and sugar and starch, right? This is what gets you in trouble in the first place. And anyway, it's kind of a pet peeve of mine. Okay, to be honest with you, in my lifetime, we've seen. I got called recently and scheduled to give a lecture. And I'm going to give a lecture on how we got here. Okay, how did we get here? Because I think most people don't understand that this idea of eating less fat and eating all these carbs and stuff, this is a new idea.
Very new.
Okay, and there's a lot of good work that's been done by some of my colleagues to chronicle the fact that this was never considered normal. And it was through politics and business that it got shoved straight down our throats. And now we have many in the medical community who for the last 40 years have sat there and bought it hook, line, and sinker without ever going back to look, doc, I'm a doctor, and doctors can be lazy. They just want stuff packaged to them, told to them so they can repeat it to their patients. And many of them don't do, 95 out of 100 won't do any original investigative work, okay, to go back and look to see, okay, show me these articles. I want to see where this evidence comes from. And so what you have is, I'm going to say it, these morons on TV who don't really know anything about medicine, right? They go to a school of journalism and learn how to be an activist. They don't have any sort of special intellect that the rest of you don't already possess. They pretend to be experts and they regurgitate this nonsense. Okay? And they have no obligation to tell you the truth. And many physicians, unfortunately, hear this and repeat it. That professional societies and organizations, in many cases, are bankrolled by these companies that make this kind of food. All right. This kind of leads to the teaching then of, hey, eat a bunch of bread, eat these grains, you know,
It's fat-free.
Yeah, that's right.
It's heart healthy.
That's right. And, you know, this stuff has caused nothing but a disaster in the American population and the world at large that adopts these kind of diets from a health standpoint. We had something going before that didn't cause that. It was called a ketogenic diet. So I'm on one of these ones that just the moment you hear a person say evidence and science, okay, that's when you should be very suspicious at that point that a load of excrement that comes from a bull has been shoveled your way, okay, and they'll disguise it like this. Okay, you should go back and look for yourself. Yeah. Okay, and that's what we do. That's why we're different than a normal practice. We just made up our minds. We're not going to sit there and repeat the same garbage to people because it makes them unhealthy. So I know that's strong language, but it needs to be said sometimes. And I have become just really put out by those in the medical community who will go along with this sort of thing and not look and see and have a fair mind about it. It just drives me nuts.
And I will just say, Tamara, because some people will still want to carb cycle, there's all these terms, right? You're going to want to just be extremely cautious about what you're reintroducing that is not considered part of a ketogenic diet, how quickly you're reintroducing it. So just be very, very cautious. Add a little something, see how you do. Add a little something else, see how you do. And then when you're reintroducing a ketogenic lifestyle, you're going to have to really take into account all the things we talk about when you're newly starting a ketogenic diet, like electrolytes and hydration and just, following the right guidelines. Okay, so just keep that in mind. Now, we do have a live question.
Yes, from Denise about menopause. Why do you do the macros with menopause? This is a good question, and it plays right in here. Michelle, what is the best diet for those that are premenopausal, perimenopausal, if you will, and menopausal?
Absolutely. Low carbohydrate.
Males call it andropause, right? Okay, they get this. Why do you think everybody in this age group gets the belly right here?
Insulin.
Okay, insulin. You become way more, the drop in your sex hormones is combined by a rise in your insulin level, okay? So the amount of insulin that is floating around your bloodstream is slightly higher, and then the amount that you make in response to the ingestion of carbohydrate, okay, in all its forms, that's sugar, flour, rice, and potatoes, okay? The amount that's secreted from your pancreas is larger than it used to be. So the peak insulin levels get higher than ever, and that causes the fat storage, okay? There is a company. They have a mascot that's a doughboy. I think you know what the company is. I'm not going to say the name of the company, but they're not lying about it. Sugar and flour cause what? The doughboy response, right? Okay, so if you buy those products, it doesn't come with the little thing where you press and he squeaks. It's just on the advertisement. Yeah. So,
Bottom line.
So look, yes.
Carbohydrates have to come down.
Yes. The diet of our ancestors is the answer. I say this all the time to patients. You know, our ancestors died from being run over by a horse, falling off a roof, or cholera and stuff like that. Okay. And the ones that lived to 70 weighed the same at 70 as they did when they were 18. Okay, because they didn't eat this kind of diet. It's not normal to gain all this weight with age. All right.
Yeah, good question.
Or this body fat with age.
Yeah, Barbara, thank you for joining us. Okay, very good question. Barbara's asking about the Atkins diet, and Atkins is a brand of a ketogenic diet, kind of like Kleenex is a brand of tissues. So an Atkins diet is a ketogenic diet. It has just transformed from what Dr. Atkins actually originated it as, which is doing what our ancestors did and cutting out flour, sugar, potatoes, pasta, and rice. And it's transformed into this very large brand, which we just have to be cautious because a lot of the products contain different ingredients that can get us into trouble because they are not really natural foods in their whole natural form. That is ideally what we'd be eating, but that's not how a lot of us are able to live in this this time of technology and working outside the home and everything. So some of the Atkins products come into play, and they can be useful, but generally ketogenic diet is the big umbrella. Atkins is kind of underneath as a certain brand of ketogenic diet.
Yeah, I would say that knowing several people that have worked with and were very close to Dr. Atkins, they tell me the same story, that he had nothing to do with the development of the products. And largely that happened after his death. And he really wasn't a big fan of these sort of products. He was a big fan of gross carbohydrate, he didn't do it. He didn't believe a whole lot in net carbohydrates and stuff like that. He taught his patients to eat real food. Yeah. And so there's kind of so the originalists, if you will, aren't real excited about the Atkins brand so much, the ones that knew Dr. Atkins, because they knew he really wasn't wild about that. Now, so they may or may not work for you. Like Michelle says, you got to watch the ingredients to see how it affects your weight. When you're trying to do a ketogenic diet, it may keep you out of ketosis because of the amount of sugar or alcohol and stuff like that. So you're not going to know it till you try it. So I'm a fan of anything that restricts real sugar, but I think on a looking at a scale of real food versus stuff that's not real food. Okay, I'm a fan of the real food if you can afford to do it.
The majority of our food hopefully is going to be whole unprocessed, but we totally understand that our lifestyle is going to require some of these convenience products. And we even carry some of them in our office. We don't carry Atkins brand, but we carry some really high quality brands of low carbohydrate, not total carbohydrate, but this idea of net carbohydrate, which is what Atkins uses. And for a lot of our patients, it does work well because it's a treat, right? It's a indulgence, or it's a once in a while. It's not like all they're eating is that. All right. Thank you for your live comments. We're going to move on to Lisa
from Durham.
Yeah, you go ahead and take this.
I've seen information about INMODE in your office. Can you tell me more about these skin tightening procedures? Yes, INMODE is the biggest company on the planet right now that does sort of non-invasive, non-surgical fat reduction, skin tightening, and muscle toning. Okay. So way back in the beginning, you had stuff like Cool Sculpt, for example, and this was marketed to do that. Well, that's come a long ways. And it's kind of the most advanced generation stuff is made by a big company called INMODE. They kind of dominate the market. We have some of their machines. If you're familiar with our Durham office, actually in the office space next door, we this year opened up a studio that does these procedures. We just call it body contouring. It's not surgical, but it's designed to do, these procedures are designed to do, just think, if you had somebody with liposuction, maybe this is the reference of how to think about it. So you, somebody with liposuction, if you were intending to gain weight, would you go get liposuction? No, you wouldn't go get liposuction. That's a bad idea, right? So just like that, this is designed to be used with a lifestyle change where you're losing weight. Okay, so this will help with subcutaneous fat reduction. Okay, at the same time, tighten your skin. All right, and if you want it, we got a feature on there that will tone your muscle. So we're about to do a bigger advertising campaign about this because it's fairly new and we didn't want to overwhelm you with stuff initially, and it's all kind of in place. My wife is a registered nurse, and she has done a lot of training on these things and done a lot of cases now. And so she's kind of spearheading that effort, and we'll be sending out some emails with that, and you'll be seeing it appear on our website. Look, I think compared to a lot of other things, you're going to find it affordable because we priced it really, when you look at the competition, we don't have to go out and recruit folks from the general public. We kind of do it just in-house.
Mm-hmm.
So we don't have to recruit you, so we can give you a price break on that. And you're already spending money as weight loss patients, so we further discounted it there. And so it's in my opinion, really affordable. Just think any area from your head to your toe, anatomic area, you can do fat reduction, skin tightening, muscle toning. And the best way to know kind of what's right for you and what that would cost, since that's an entire body and everyone's a little bit different, is to just have a free consult with Anna.
Mm-hmm.
Okay, so you call the office and say, hey, that INMODE stuff sounds really cool. I kind of want to know what's involved. And what we can do is just have Anna call you, okay, and then set up a time where you can come by and she can explain it to you, show you the machines, say, get an idea of what you're concerned about, and then she can tell you, hey, here's what I think this would, here how many treatments it would take, here's what it would cost, and it's no cost. We don't put any sales pitch on you.
Mm-hmm.
No, we don't twist your arm or anything. I don't want to be that guy. And so we want you to know it's there and it can help you, but we want patients who are really actively losing weight and working on it. Because this can really, really help in that scenario. And there's no downtime or anything like that. So you can go get the treatments, go right back to work, all that. And if you're actively losing weight, wham, it really is pretty phenomenal. So anyway, keep watching our emails, keep looking at our website. That stuff's coming soon. And if you want to do so, start asking questions now, just call either office, say I'm interested in the INMODE stuff. We can then put you in touch with Anna and she can take the ball from there. Okay. Dara from Raleigh.
Do supplements make a good gift? What should you consider before buying them for someone?
Yes.
And yes, they make an excellent gift. I think the gift of health is better than any other gift of anything related to supporting someone's health and wellness, whether it's mental, physical, emotional. I am all for it. And that is why we are big fans of carrying supplements in our office for our patients. And a lot of our patients do buy our supplements, including our CBD oil, for family members, for loved ones, for friends. I think that is a marvelous idea, Dara. And we have an immune package as well that we're selling.
Yes. And it's, so look, we carry Metagenics products, and what I would, which are the best. Okay. And so what I would just tell you is that some things in life you can't do a study on. There won't be a study on. And this is the limitation of modern medicine, is we want to study on everything. Okay. But there's no study, I always say, on parachutes, right? To validate that they work. But which one of you are going up in an airplane and going to jump out without a parachute because there's not a study? Okay, none of you, because you'd have to be a complete fool to do that, all right? And this is the way it is with a lot of supplements, okay? Big companies and the government doesn't want to put up money to sponsor these enormously expensive studies. Okay, it doesn't mean they don't work. Okay, a lot of these things have been in use for thousands of years in human beings and have proven themselves in other cultures to work, okay? And so this immune package is designed, it's basically $79, $80 worth of stuff for $55. Okay. But I packaged it together because I can't say it. I can't say it because apparently we don't live in America anymore where we have First Amendment rights to say it without some bozo taking me off the internet. Okay. But the bottom line is it works really good on boosting your immunity against things like viral infections. I'm not going to say names, but one starts with a C and the other starts with an I. And this time of year, they circulate around. Okay. I just think it would be wise to have your immunity up to speed in this season, right? And this is why we sell this stuff. I'm not selling it as a cure. I'm selling saying, hey, take care of yourself. It pays off. So,
Just a reminder too.
Makes great gifts.
Yes, great gifts. Thanks for the question. We are open. We're seeing patients. We have these supplements in our office. And today we are giving away a $25 Target gift card, which you do not have to spend on supplements at Target, but you could. So in order to get that gift card today, we need you to like this video, and then we need you to comment #SimonsAMA in the comment section.
Yep. That's right.
All right. So John from Durham, will taking testosterone enhancement help with weight loss?
Well, I don't know. It'll help with fat loss.
Mm,
It may or may not help with weight loss.
Right.
So the idea is the reason weight loss is good for people is it causes them generally to lose body fat, and excess body fat is a problem. This is where kind of the nature of obesity really lies. So to the extent that you have a low testosterone level and you then supplement that, okay, and bring it up to normal, maybe you're doing some exercise with eating right,
Yeah.
you'll find that diet and exercise together with that will change your body composition over time so that your body fat goes down. And if your weight doesn't go down tremendously, I'm okay with that because there's not a health problem, a metabolic type problem known to be associated with leanness.
Right.
Okay, right? So
Even if your weight's higher, if
Yes.
it's due to muscle mass,
correct.
that does not confer the same risks
That's right.
that if your
Yes.
body fat percentage was higher. So that's really the goal
That's right.
of our practice too. So I think the moral is it could for sure, but it must be in the context. As with anything that could help, it has to be in the context of a healthy lifestyle plan that's actively trying to reduce body fat
Yeah.
and increase lean body
I had a
mass.
patient, the very first patient I ever had that was doing this. This was a long time ago when we first opened up about 17 years ago. And I knew I worked with a sister. He came in and said, "Man, I'm doing this stuff, and this testosterone." He said, "I can eat cake anytime I want, and not gain weight." And I'm like, okay.
That's not how this works.
That's right. Yeah. So you don't want to be that guy, okay?
No.
We want you to eat right, be exercising, because it really works great in that scenario, right? Your overall health matters.
Right.
Yeah.
And thank you, Robin. Anyone
Yeah.
else who's watching, don't forget, #Simonds AMA.
AMA.
Like this video. We got a Target gift card waiting
Target
for
gift
you.
card,
The end of the
hashtag
show.
Simonds AMA, like this video in the comment section, and hashtag Simonds AMA. We're going to announce the winner here soon, actually.
Yes.
Okay, so we got Sarah
Thank you, Adrian, as well.
from Cary.
Yes, Sarah, do you work with gastric bypass patients? What success have you seen? Yes, we work with patients who have had all of the different surgical procedures. The most common procedure now is actually the sleeve gastrectomy, and I have many patients who have had the sleeve procedure. As
We
well
work
as the
with
gastric
patients like
bypass.
this all the time.
Yes.
Some of them who recently had it, and some of them who had it, say, 5 years ago, and now they're gaining weight back.
Right.
It works in both patients.
Absolutely.
There's, I would say the kind of struggle that's going on within obesity circles, this is a little inside baseball here, but, the surgeons realize that over the long term, they need stuff like what we're doing. Okay, so they can anatomically change you, and for a few years it's working good, but you can, and the data's clear. You can out eat that and out drink that stuff. And so kind of we stay focused on 4 things. Okay, diet or nutrition, physical activity, behavioral modification, and medications. Okay, and this brings in the whole medical and behavioral side of things, and this is still needed in patients who've had surgery. So I've had patients who could only get down to a certain point with surgery, then do what we're doing here, and they lose an additional 50 pounds, for example.
Right.
So I think that if you're starting to gain weight back, come on. If you want additional help with your weight loss from the surgery, come on. We can help you. It's safe and works well.
Yeah, and I think it would be good to address some stigma at this point, because I do have many patients who they personally don't feel like surgery is an option because they say things like, well, everyone I know who has gotten it has gained their weight back, or the risks are just so high. And it is a surgery. It is a risk, but it is a very effective tool. It is not a cure.
Yeah.
But in obesity medicine, because it is a chronic medical condition, we really are treating over the lifetime. And surgery is one tool that for individuals who have a higher BMI or more weight to lose, or who just struggle more, it can really be an important or vital tool in order for them to begin their journey and then the medical weight loss side, which is us, are able to help them continue it. So I would just say the risks are actually much lower for complications and death than even some of the surgeries that a lot of people get, like getting their gallbladder removed,
Yes.
getting their appendix removed. So that's an important myth to put to rest, as well as the myth that, well, everyone just regains their weight anyway. And actually that's not true. While there is some weight regain, the vast majority of patients who have had either the sleeve or the gastric bypass or something called the duodenal switch, they do keep a good amount of weight off, which confers extraordinary health benefits. Many patients, especially with the gastric bypass, if they started with diabetes before, it is gone, and it will be gone generally for life. So there are other health reasons too to get a weight loss surgery. And we live in an area, luckily in the Triangle, there are many health systems that offer weight loss surgery, and there's some great centers around here. The trick is also having us in your corner, because it needs to be surgical and medical in partnership, not, well, I will only do, the pills and see medical, or I will only do surgery. For some patients, it has to be both. Now, having said that, there are many patients in our practice who maybe were candidates for surgical intervention, and they have done beautifully with medical intervention without the surgical, and they did get to avoid any risk or surgical intervention. So that is absolutely a possibility and a probability. We have many patients who do that. That does not mean, though, that if you are considering a surgical option, that means that you're a failure on the medical side, or that you should have been able to do it without the extra help, because surgery, again, it's a tool. We need every tool we can have in our toolbox.
I agree with that 100%. I do. And I wouldn't, whether it's medical or surgical, I would never let your friends and colleagues promote the idea to you that somehow you are weak. That is baloney.
Yes.
Yeah, that's baloney.
Our patients are some of the hardest working, strongest, motivated people I know. And that really ties to that bigger issue of stigma is we really need to work on, as a society and as individuals and as healthcare providers, to stop associating weight struggles with any kind of personality flaws whatsoever. It is a medical condition that requires medical treatment and sometimes surgical treatment.
Yeah.
So we emphasize that. And even with self-talk, I talk to my patients a lot about that positive self-talk of really trying not to go down a rabbit hole of, well, I should have, then I would have, and I could have. It's like, no, what we're going to do now is move forward.
Yeah. The one final thing I would just say there before we announce the winner, is that, look, obesity is the most pro-inflammatory disease, really, that your body is. Systemic inflammation. Think of it that way. A very pro-inflammatory disease. And so you don't have to lose a ton of weight to get really healthy. There's another reason to do it. You can really decrease that inflammation. And this matters in this era of kind of the COVID pandemic, if you want to call it that, because that's an inflammatory process. Once the infection takes place initially and the virus replicates, it becomes an inflammatory issue. And if you're already really inflamed, this can get you in serious trouble. And so, outside of age, the number one risk factor for dying from this virus is obesity. And it's because of this inflammatory business. So I've been saying from the start, don't act like you have to achieve some model's weight. You can lose 5 to 10% of your body weight and be eating right and getting some exercise. And this will dramatically, in my opinion, alter your chances of a negative outcome. And America needs to be doing it. We're not putting enough emphasis on that. So this is the place you can come and we can help you. And you don't have to lose a ton of weight to have a big impact on this sort of thing. So let's announce the winner of the Target gift card.
The winner is
my buddy, Barbara Burton. All right, Barbara. Yes.
Thank you for everyone who entered today for our gift card drawing and just for being here with us. Please submit your questions through our website, simonsmetabolics.com. Check out our recipes at the Casual Keto Doctor. Check out our emails.
Yep.
And we will see you in 2 weeks.
Sounds good. See you in 2 weeks, everybody.